emergencies, including field epidemiological training programs, public health emergency operations program, as well as the program for bioinformatics. As we reimagine health workforce on the continent, we need to remember, as has already been said, that Africa has significant shortages of health workers, and this will require our careful planning and investment to ensure that their education, their employment, retention, and distribution across the continent responds to the priority areas for public health emergencies. Furthermore, the emergence of the COVID-19 pandemic has exposed the need for us to rethink and redefine the approaches that we use in health security on the continent. We therefore have identified the following 4 areas that will require our attention in the process of reimagining health workforce on the continent. First is we need to, in this 21st century, translate our efforts into both health and economic gains for Africa, so that we see investment in health as actually an investment and not a service that consumes resources. To back this up with evidence, Africa CDC is working to conduct a health impact assessment and a continent-wide physical space analysis to clearly identify both health and economic gains and challenges that we have faced during this pandemic. The second area is accelerating investment in the female workforce. As Her Excellency clearly pointed out, the vast majority of our health workers are actually female. In reflecting on our current realities and forecasting the future of Africa's health security, gender equity will remain at the core of our model to ensure that the optimal maximization of female workforce is planned for and delivered for a more resilient health system in Africa. We can achieve this by putting in place gender transformative healthcare policies. Third is the need for private sector collaboration. And this we can do by scaling up innovative approaches to ensure that as we develop and strengthen our skilled health workforce on the continent, we utilize the broad infrastructure of the private sector in Africa. Finally, monitoring and evaluation of all the public health workforce programs and initiatives on the continent is critical, because only what is measured is done. We can do this through clear, high-quality, comprehensive, and interoperable sources of health workforce data to present the evidence that we need that investing in health workforce actually does give benefits to our socioeconomic development. Excellencies, distinguished guests, ladies and gentlemen, as we conclude, I would like to remind us that very recently, under the leadership of the Republic of South Africa, the UN General Assembly passed a resolution to establish a high-level meeting for pandemic preparedness and response. I would really urge our member states and partners to ensure that as these discussions on the high-level meeting for pandemic preparedness and response continues, that health workforce is at the core of those priority issues that are going to be covered under the high-level meeting. I wish us all very productive deliberations today, and we as Africa CDC are looking forward to your wisdom, your recommendations to ensuring that we truly reimagine health workforce development on the continent of Africa. I thank you. Excellencies, I would now like to invite Dr. Raji Tajuddin to moderate the next session. Taj, you have the floor.
And thank you, Ahmed, for very great opening session. So, Your Excellencies, distinguished participants, ladies and gentlemen, all protocols duly observed. The COVID-19 pandemic and the ongoing multi-country monkeypox outbreak have actually shown that a fit-for-purpose and adequate health workforce are needed globally, now more than ever. And it's high time we recognize the value of healthcare workers in keeping our world secured and safe. And a strong health emergency preparedness and response architecture can only be guaranteed with a competent health workforce. The 77th UN General Assembly has presented us with another opportunity to reimagine health workforce development in Africa for Africa's health security. So on that note, we have partners who are queued up to actually give us their remark as far as this particular second session is concerned. And to set the ball rolling, I would like to invite Madam Julie Ijuru, who is the Chief Public Affairs and Communication Officer for MasterCard Foundation, who is representing Ms. Rita Roy, the CEO of MasterCard Foundation, to set us rolling as far as this session is concerned. Julie, the floor is yours.
Thank you very much, Dr. Taj. Your Excellencies, ladies and gentlemen, it's a great pleasure to be with you all today to talk about the development of a robust health workforce. This resonates very, very strongly with the MasterCard Foundation, as our work is guided by a strategy, Young Africa Works, that seeks to enable 30 million young people, particularly young women in Africa, to access dignified and fulfilling work by 2030. And so allow me to give you an insight into some of our work, because we are already walking this journey. This year, we mark 10 years of the MasterCard Foundation Scholars Program, an education and leadership development program that has enabled nearly 40,000 young people to pursue their secondary and higher education. Many of those have gone into public health. Over the last 2.5 years, we have worked with the Africa CDC to respond to the pandemic. As many of you in this room know, in 2020, we trained, equipped, and deployed over 12,000 community health care workers under the Partnership to Accelerate COVID-19 Testing and Tracing, PACT. Again, as many of you know, last year we launched Saving Lives and Livelihoods, a $1.5 billion partnership with the Africa CDC to purchase vaccines for more than 65 million people on the African continent, to enable vaccinations for millions more, to strengthen the Africa CDC, and we are also laying the groundwork for vaccine manufacturing through a focus on workforce development. Moving forward, additionally, I'm excited to let you all know that we are working with the public and the private sectors and with academia to grow Africa's health workforce. The foundation is convening a $200 million collaborative with 7 African higher education institutions and the University of Toronto to train 30,000 primary healthcare workers, launch over 2,000 health ventures that will create more than 10,000 work opportunities. Creative is able to build a resilient, fit-for-purpose workforce. Reimagining the health workforce is critical, not just for health security, but also for economic security on the African continent. We are committed to this work, which must be driven by innovative, action-oriented partnerships built, as we said earlier, on respect. We will continue to work with Africa CDC and other partners towards these common objectives. Let me finish by reiterating the words of Her Excellency Ellen Johnson Sirleaf. The time to act together is now, and we are walking this journey together. Thank you so much.
Julie, for those great remarks. At this junction, it gives me a very great and special pleasure to invite Ambassador John Nkengasong, the U.S. Global AIDS Coordinator and Health Diplomacy, to give his remark. Dr. John, the mic is yours.
Thank you, Dr. Taj, Excellency, Chairperson of the African Union Commission, Excellency Musa Faki Mohammed, all commissioners here present, Acting Director General of the Africa CDC, Dr. Umar. Excellency, it gives me a pleasure to really have been invited to share some reflections on what PEPFAR can do as Africa CDC moves forward with strengthening workforce on the continent. Let me spend a few minutes bringing up to speed some of you that may not be too aware of what PEPFAR does. As you all know, PEPFAR stands for the US President's Emergency Plan for AIDS Relief that was established in 2002. So next year, 2003. So next year, PEPFAR will be celebrating its 20th anniversary. It was established at a time, a critical point where the world was confronted with the fight against HIV/AIDS, which was devastating many parts of the world, especially in Africa. Life expectancy had dropped significantly. Families were shattered, and it generated tremendous fear and hopelessness in the societies. I recall a few weeks ago in Geneva when I met with Dr. Tedros to think through what PEPFAR has done. He summarized the achievement of PEPFAR in 3 words: hope for the family, hope for the individual, and hope for the nation. I start there, Excellencies, just to reiterate that over the last close to 20 years, the program has invested 100 billion in Africa to support the fight against HIV/AIDS and has strengthened tremendous health systems, including workforce development. Just to run some numbers by you, over the last close to 20 years, PEPFAR has trained over 300,000 healthcare workers, strengthened and established over 3,000 laboratories, strengthened over 70,000 health facilities, and trained several hundred epidemiologists. In March this year, Excellency, you recall you signed a memorandum of cooperation with Secretary Blinken as part of Africa CDC's partnership with the United States government to continue to strengthen several components of global health security, including workforce development. The Biden and Harris administration is committed to strengthening workforce development. They've just launched the Global Health Workforce Initiative, which aims to continue to strengthen workforce across the world, especially in the context of health security in several dimensions. And we truly hope and look forward to working very closely with the African Union and Africa CDC to move these programs forward. Workforce, as the new public health order that Dr. Umar laid out as outlined, is critical component of the new public health order that you have announced. And we as partners stand by to support you in this initiative as you implement your new public health order for the continent. We hope that as we move forward with this initiative, we'll look at several cadres of workforce development, including nurses, medical doctors, epidemiologists, and community healthcare workers. We believe that we can leverage the power of PEPFAR, which is a vertical program, as well as the United States supported the President's Malaria Initiative to advance the cause of expanding workforce development on the continent of Africa to meet the challenges. Let's work together, and you can count on us as partners that we use the PEPFAR platforms to support your initiative as much as possible. I thank you for inviting us to be part of this dialogue.
Thank you, Ambassador John. At this junction, we would like to excuse His Excellency Chairperson Musa Faki Mamat for another critical engagement. So, Your Excellency, thank you for coming. So, Excellencies, distinguished delegates, ladies and gentlemen, it gives me a great pleasure to introduce the Deputy Chairperson of the AUC, who has just stepped in to take over from the Chairperson, Madam Monique. Thank you for joining us. So to continue our session 2, so I would like at this junction to introduce Dr. Priya Basu, the head of Secretariat Financial Intermediary Fund on Pandemic Preparedness, Prevention and Response at the World Bank, to give the World Bank Group remark. Dr. Basu, the mic is yours.
Thank you very much, Your Excellencies, ladies and gentlemen. It's a great pleasure to be here with you today. I wear a few hats, one at the World Bank in charge of the COVID-19 response, and then another heading up this new secretariat for the newly established Financial Intermediary Fund for Pandemic Prevention, Preparedness and Response. Let me first say a few words on behalf of the World Bank's Africa region. We have a long and deep partnership with Africa, and we're very proud to be partners with Africa across so many areas, including health and including the COVID response over the past few years. The World Bank has continued to deepen its partnership with the Africa CDC. I'm pleased to share that in July of this year, a $100 million regional financing project was approved to support the Africa CDC. Our vision is very aligned with the new public health order that was referenced, that's been set out by the Africa CDC, with a focus on immediate needs as well as long-term needs. The project will help us scale up the support of the Africa Volunteers Health Corps, and the goal is really to build a health workforce for the future. We do believe that a strong and resilient health workforce really is the cornerstone of health systems strengthening. If you allow me, maybe just a couple of words on this new Financial Intermediary Fund for Pandemic Prevention, Preparedness and Response. This is a partnership between